Is the sun feeling unbearable? You may have missed the forecast earlier this year from the Department of Meteorology, which predicted that Uganda and its neighboring countries would experience unusually hot weather with temperatures soaring as high as 40 degrees Celsius. The forecast also warned that the Greater Horn of Africa would see below normal rainfall from March to May 2025, intensifying the heat wave across the region. In light of these conditions, health experts are urging the public to take extra care when exposed to the scorching sun.
What we need is to rehydrate a lot. Rehydration, I mean take optimal amounts of water with the minimum of 1.5 liters every day, and of which that should be the normal, and here we have to increase. But bare minimum, a minimum of 1.5 liters of water every single day. And also sunscreen, because you're going to see a lot of people, because we are people of different skin tones. You know, we have albinos in here as well. So if you're an albino out there, this encroaching sun, you should stay out of it actually. That should be the best for you. But if it's inevitable because of the work space, because of what you have to do, wide brimmed hats, protective clothing, an umbrella with you, and also wake up early. Do what you're supposed to do before the sun comes up, then also leave work late so that you avoid this time when the sun is really high.
What would you recommend for children, for example, who may not be able to express themselves very well in terms of how they are feeling regarding their bodies because of this heat wave?
Children, their temperatures are going to increase. That means we may see a lot of what we call heat strokes coming in. Heat strokes come because our bodies are exposed to extremes of temperatures and they cannot handle it. They're characterized by fast pulse rates, the heart is beating, and also some people may faint because of this extreme of temperatures. Then another thing, these children are going to develop what we call miliaria. It is a condition whereby the sweat glands become blocked, but because of this increased sweat extrusion from the glands and the pores become blocked, they have this kind of rash, which we call a heat rash. Yes, so we're going to see more of heat rashes in the kids.
What is the recommendation for anyone out there who is going to do work and also to ensure that they take care of their skin very well?
For this extreme of hot environment, there is always a negative implication on the skin. First of all, your body has to adjust to this extreme of temperature by sweating a lot. Okay, so by sweating a lot, the body is going to cool off the excess of the temperature. So in the due course of actions, the skin is going to become more dry. So when it's dry, it's going to become more irritated. So people who have chronic illnesses such as eczema, such as rosacea, is going to become exacerbated. So you're going to see a lot of cases of eczema because of this heat wave. Then another thing, people on the skin, people are going to become dark. Because if we look at one of the causes of hyperpigmentation, sun exposure, and here if you look at the UV, what you call the UV index is at its highest in our region currently. Yes. You said we are 34, but the normal, the WHO recommends like the normal ambient external environmental temperature should be at least 18 to 22. So we are 35, that means you're like 13 degrees Celsius higher than the recommended one. So a lot of negative impact is coming into the body.
Walter Mwesije, NTV.